So hi, my name is Mark, M-A-R-K, Kendrick, K-E-N-D-R-I-C-K, Frianeza, F-R-I-A-N-E-Z-A. So before I started, I'm gonna show you guys the environment that I'm gonna be using on. Okay, so before I start as well, I'm gonna introduce you to my patient. He's my father. He's gonna be acting as Mr. Dan as the patient. So before further ado, I'm gonna be gathering my equipment and I'm gonna sanitize it and show you guys hand washing. Okay. Okay, so now I'm all set. I'm gonna go inside the patient's room and start my assessment. So hi, my name is Mark, M-A-R-K, Kendrick, K-N-D-R-I-C-K, Frianeza, F-R-I-A-N-Z-A, and I'm gonna be a nurse student for today. Before we started, do you need to go to the washroom to empty your bladder?
No.
No? Um, so okay, so do you feel comfortable and safe in this room?
Yes.
Yes? Okay, so patient's privacy. Okay, so now before we started, I'm gonna ask you a little bit of questions. So first, what was your name, age, and your date of birth?
I'm Dan, February 14, 1970,
And your age is
55.
50. Okay, so he is well alert, and now I have my next question is gonna be, when did this all started?
I think a week ago.
A week ago. Okay, so do you feel any chest pain?
No.
No. Okay, so do you feel any chest pain? Did you have any cough or fever?
No.
No. Okay, so are you on any medication?
No.
No. Do you have any allergies?
No.
No. Okay, so now I'm gonna go and start inspecting his ear. Okay, so his ear is symmetrical on both sides. No discharge, and the cerament is present as well. So now I'm gonna go and palpate his ear. Do you feel any pain?
No.
No? Okay, so no pain and no tenderness. Okay, so now I'm gonna go and inspect his nose. Okay, so his nose is on midline, no lesions, no deformities, and no discharge as well. So now I'm gonna go and palpate his sinuses. So do you feel any pain?
No.
No? So no pain, no tenderness. Okay, so now I'm gonna go and inspect his mouth. So, Mr. Dan, can you open up your mouth for me, please? Okay, so his lips is dry, it is well hydrated, no lesions, no fissures, and his gums is also pink, no bleeding, no lesions, and no swelling, and his teeth is intact, no cavities, no caries, no repairs. It is the shape and positioning is normal. And can you stick your tongue for me, please? Okay, so his tongue is well hydrated. It's pink and white. It is there's no fissures and no muscle atrophies and no involuntary movement as well. So now I'm gonna inspect his cranial nerve 9, 10, and also the 12, which is the hypoglossal, the vagus, and also the cranial nerve number 12 is the hypoglossal as well. Okay, so I want you to say open your mouth for me, please, and say ah. Okay, so and now I want you to stick your tongue for me and move it to the left and to the right and up and down. Okay, so I want you to say light, tight, dynamite.
Light style dynamite.
Okay, so the cranial nerve 12, 10 and 9 is intact. So now I'm gonna go and inspect his neck. So as I can see, the skin color is proprietary background. It is symmetrical on both sides. No lesions, no deformities. It is dry, and the tracheal is on midline, and the neck is on midline as well, and no visible masses as well, and there is no enlargement of thyroids. Okay, so now I'm gonna go and palpate his neck. So do you feel any pain here?
No.
No? Okay, so no pain, no tenderness. The temperature is warm, and no crepitus or any muscle. There is no crepitatus as well. So now I'm gonna go and palpate his carotid artery. Okay, so the carotid artery, the rhythm is normal. The rate is 60 beats per minute, and also the strength is symmetrical on both sides. Okay, so now I'm gonna go and check his muscle. Now I'm gonna go and check his musculoskeletal. Okay. Okay. So first of all, his skin color is appropriate to her background. It is symmetrical to his body. The hair distribution of her body is well distributed. No deformities, no lesions, no swelling, no edema, and so as I can see, there's no muscle voluntary movement as well, no muscle atrophy, no diaphoresis, and also yeah. So now I'm gonna go and palpate his muscles. So do you feel any pain? A little bit?
Yeah.
Okay. So he has a little bit of pain and tenderness. So now we're gonna test his range of motion. Okay, so Mr. Dan, I'm gonna test your range of motion right now. First, I want you to do flexion and extension, and then flexion, and then extension, and then ulnar deviation, and then radial deviation, and then flexion, and then extension, and then I also want you to do supination. Okay, and then the deviation. There you go. And then I also want you to do abduction, and then adduction. I want you to shrug a little bit. Okay, and also I want you to do internal rotation. Okay, and I want you to do external rotation. Okay, thank you. So so he has a range of motion is he has a little bit of difficulties because of the pain. His range of motion is a little bit difficulty. No crepitation, no involuntary movement as well. Okay, so now I'm gonna go and test his cranial nerve number 11, which is spinal accessories. Okay, so Mr. Dan, I'm gonna be pushing your down under your shoulder. I'm gonna put a little bit of pressure, and I want you to shrug as much as you can. Okay, so the next one is I want you to look on your left hand side and touch your shoulder using your ears on your left hand side as well. Okay. Okay. So his cranial nerve number 11 is intact, and no muscle atrophies, but a little bit of pain as well. Okay. So now I'm gonna go and check his lungs. Okay. So his lungs is his lungs is his lungs is the skin is appropriate to his background. It is symmetrical on both sides. As I can see, his chest expansion is symmetrical on both sides as well. No visible masses, and the pulsation is is normal. The rhythm is normal, and yeah. So now I'm gonna go and palpate his lungs. So do you feel any pain, Mr. Dan?
No.
No? Okay. So no pain, no tenderness. It is warm. And also, the chest expansion is symmetrical on both sides as well, and no visible masses. Okay, so now I'm gonna test his tactile firmness. So I want you to side a little bit here. Sit a little bit side. Okay. So I'm gonna check your back. Okay, so I want you to say 99 for me, please.
99.
One more time.
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 99.
Lastly.
99.
And last.
99.
Okay. So there's no crepitation. The way he say it is actually normal as well. And now I'm gonna do the frontal checkup for him, for his lungs. Okay, so can you please sit properly right now? And now I'm gonna do auscultation for him. Okay, so I want you to inhale, exhale, inhale, exhale, inhale, exhale, another one, exhale. Okay, so as I can hear, there's no bruit, no crackling, there's no congestion. He is on a labored breathing, but no crepitus, and also no shallow breathing. And his rate is for his rate. Okay, so just breathe normally. Okay, so his rate of breathing is 18 per minute. His rhythm is normal, and also, he has a unlabored breathing as well. So that's it for today, and that is Mr. Dan as the patient for my second lab assignment.